Good afternoon. My name is Franay Bain, and I will be presenting on the strategies to improve clinical assessment. It is important for health professional programs to provide opportunities for students to connect theories learned in the classroom with real-life clinical situations. Fieldwork at healthcare facilities allows students to do this. Planning fieldwork for students requires a lot of work. Most importantly, it requires proper documentation to ensure that the experience is fruitful. When proper documentation does not occur, students and preceptors can face challenges during fieldwork. For instance, a study conducted to determine the experience of occupational therapy students in their first fieldwork education showed that students encountered challenges with supervisors' management and challenges in the learning environment. To help alleviate these issues by improving clinical assessment, proper documentation must be performed before, during, and after completion of the fieldwork. The components of documentation during these phases will be discussed in this presentation. The first phase of documentation is the pre-fieldwork documentation, which is performed prior to commencing fieldwork. It sets the tone for the clinical experience. Documentation during this phase should include a signed agreement indicating that the site is willing to accept a student for the field experience. It should also include how long the field experience will be, the clinical hours that is required by students to successfully complete the experience. It should also include the student's schedule, as well as the software that will be used by students and preceptors to document exams, submit case studies, and student evaluations. Pre-fieldwork documentation should also include the responsibilities of students as well as teachers. This is important so that they can be prepared prior to the experience so that they can perform effectively. Some responsibilities of clinical supervisors and preceptors can include providing an orientation to students about the clinical site, introducing students to the various sonographic and patient care protocols that they will perform during the experience, teaching students sonographic techniques and skills where needed, as well as supervising students as they participate in sonographic exams. Preceptors are also required to answer students' questions and complete evaluations of students. Students' responsibilities can include observing the rules of the clinical site and maintaining professionalism, wearing a student ID and designated scrubs while on site, maintaining attendance according to the prescribed hours designated by the program, and observing and performing sonographic examinations under supervision. Students should also be documenting these exams performed to meet competencies, and as well as they should be submitting case studies as scheduled by the program. The second phase of documentation is performed during fieldwork. Students and preceptors should be provided with a competency assessment form to ensure that students are aware of the educational goals and work progressively toward them, and to ensure that preceptors can effectively teach and evaluate students. Responsibilities indicated in the pre-fieldwork documentation should be implemented by students and preceptors during this phase. Competencies for vascular sonography that should be observed includes lower extremity arterial duplex, lower extremity arterial physiologic testing, ankle brachial index, lower extremity venous DVT exams, carotid bilateral exams, upper extremity venous exams, upper extremity arterial exams, and visceral vascular examinations. The final phase of documentation is the post-fieldwork documentation, which is performed subsequent to fieldwork experience. After students have completed their fieldwork, It is necessary to retrieve feedback about the experience. This can be performed using an online survey. Students' participation in this part of documentation is important to determine the effectiveness of clinical sites and appropriateness for students' engagement. Therefore, students should be encouraged without fear of consequences and made aware of its benefits to improve the fieldwork experience in the future. To conclude, this presentation has provided information on the key elements of documentation to improve the fieldwork experience. I hope it was helpful, and thank you for your attention.